the staff at the hospital who have been a part of your journey, particularly the residents and other interns who I'm sure you will remember for, if not your professional career, certainly parts of your life. But particularly from the office of the DMS, Donna and Katrina, who have helped all with the administration and making things go smoothly when things didn't want to go smoothly. A lot of work done there. But particularly to the 5 of you, including you, Rebecca, sorry to be backing you. Well, no, I'm not backing you. You can see me this way, right? I'm really, really happy that you have been the 5 finalists. This was the easiest selection process, even though we had 9 finalists. Let me explain a little bit about the selection process. You were all graded along the way. We added up all those marks and came up with all those who would have had a cumulative high score. That was 9 people that reached the threshold. We then had a sub-list of who was in the top 5 in each specialty, and that wasn't always the people with the highest grades, because a doctor is more than just academics. So we created a short list, and then the selection committee was by the heads of departments or their representatives, and the chief residents of their representatives. And we went through it, well, they went through it blindly because I didn't give them the totals at the beginning, because the intern of the year is the doctor who we think exemplifies all the ideal qualities at the early stage of a career. You all obviously have degrees, so we'd expect you to be intellectually competent. You have all passed your rotations, so we expect you to be professionally competent, but this is not a awardable competence. It's about excellence and character and so many of the things which we sometimes take for granted but expect in a doctor. Not just the bedside manner, which is sort of a popularity contest, not just the academics, which is another part of it, but a lot of it is coming down to, I guess you would call it, judgment, synthesizing all that you have learned and experienced, but most importantly, putting your patients first. And I was really happy that the 5 of you turned out to be all outstanding interns. You can only expand a program like an internship so much without diluting it to the time when it doesn't meet the criteria, both the standards we would want in number of supervising mentors and doctors and numbers of patients for experience. So we are limited at a cohort of 36 interns, regardless of how many are graduated by whatever medical school. We are a teaching hospital of the University of the West Indies, and our interns who have trained here with us as undergraduates, it's like welcoming them home rather than displacing them to replace them with somebody that we haven't trained. So yes, it is a juggle. Oftentimes the demand is by factors beyond our control. What we are very pleased about is that once we accept people into our program, we do all that we can to make sure that they have reached the level of competency and skill so that they can be registered by the Medical Council of Barbados. But on a day like today, we particularly like to salute the high quality and excellence of the program as exemplified by our outstanding interns and intern of the year. Complicated all of our lives in the country. It's complicated the lives of all our patients, but particularly for healthcare providers, yes. And out of the list of healthcare providers, the interns are our first point of contact, usually our consistent point of contact, the overwhelming presence. If the patients remember one person as a doctor in the hospital, it's usually the intern. They have been asked not only to continue a very hard role, but to do it in PPE, to do it as young, and to do it in a large extent as female. The quote that comes to mind is that Ginger Rogers did everything that Fred Astaire did except backwards and in heels. They have been asked to assume a very, very strenuous role and to do it in a time where extra demands were made. It is in no small measure due to them, the healthcare workers, the whole response of the Queen Elizabeth Hospital, that in the time when our country was most vulnerable, we have so far managed to keep the Queen Elizabeth Hospital as a COVID-free zone. So yes, it did pose challenges, it continues to pose challenges, but thus far, I'm really pleased that we have risen to the occasion.